So here we have my chicken breast in which I'm simulating a bilateral labial tear that I am going to repair with interrupted sutures. So you're wanting to get enough, so you can see the tear there, so you want to get enough of the healthy tissue in as well, just to hold it together. If you're only going in the tear, then it's going to just pull through because it is so friable. So come out. And then I like to perform a instrument tie. So it is 1, 2, 3, and then I pull my tail through. So with the interrupted sutures of the labia, it is important to just pull it tight enough to bring it together, but not so tight that it's going to cause puckering. So I try to do the first pass over and then the second one, 1, 2, going under. And then with the second tie, that's when I really pull it firmly so that the knot doesn't come undone. But the first one, I'm really careful not to create too much tension because then you're going to see some puckering of the skin, which would be more uncomfortable for the woman. 2, 3 over. So how I perform an instrument tie is, and then the last one just really tight. I do 3 over and then 2 under and then 3 over. Okay, so that is my tie, and now we're going to cut that. So you leave about 1 centimetre. And then we're going to do one more, so enough of that healthy tissue. Then holding the needle with my clamp to help prevent a needle stick injury. 2, 3. So this is the one that I'm just a bit more cautious of. So it's enough that it's bringing it together, but it's not putting too much tension that it's going to be uncomfortable. 2. And then this is one that I make sure it's nice and tight so it doesn't come undone. And then final one, 3. And make sure that's nice and tight. And then so that one's come back together nicely. Then we're going to do the opposite side. So you can see your a little bit bigger tear. So you're going to go in that, get a good amount of that tissue so it holds it together and the sutures don't pull through. Doing your instrument tie again, or hand tie, whatever works for you. This is just what I personally find I remember the most, especially when it's been a while in between. And that's where I'm going to make sure it's nice and tight. And sometimes the skin can be a bit tough to push through, so you can use your tweezers just to help guide that needle through. Pulling that nice and firmly. There we are. And that is how you do interrupted sutures.